Call the meeting to order for the Deschutes County Board of County Commissioners. It happens to be October 9th, 2024. Please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which it stands, one nation under God, indivisible, with liberty and justice for all. All right, we do have citizen input. Has anyone filled out any forms in the room? I don't see any. Stephen, is anyone online? Okay. All right, then, let us go to the consent agenda.
Move approval of the consent agenda.
And I will second it.
Any discussion? Calling for the vote, Commissioner Chang,
Yes.
Commissioner DeBonne,
Yes.
and the chair votes yes. So let's go to action item number 3. The second reading.
Good morning, Commissioners. For the record, Kyle Collins, Associate Planner. I am just here for second reading of our housekeeping amendments package. Just as a very quick recap, the board held a public hearing on this particular set of amendments 2 weeks ago. After that hearing process, they elected to close the record and commence deliberations, ultimately adopting the amendments and commencing first reading. With that, if you have any questions for me, of course, I can answer them, but otherwise, just here for a formality.
Just to confirm, no changes between the first and second reading?
Correct, no changes.
Great. With that, I'll move approval of second reading of ordinance number 2024-008, 2024 housekeeping text amendments by title only.
Second.
It's been moved and seconded. Any further discussion? Commissioner DeBonne,
Yes.
Commissioner Chang,
Yes.
and the chair votes yes. Approval by title only. Approving ordinance number 2024-008, an ordinance amending Deschutes County Code Title 15, Buildings and Construction, Title 18, Zoning Ordinance, Title 19, Bend Urban Area Zoning Ordinance, and Title 22, Procedures Ordinance to incorporate changes to state and federal law and provide clarification of existing regulation, procedures, and policies.
And now I'll move adoption of ordinance number 2024-008.
And second.
And is there any further discussion? Seeing none, Commissioner Chang, calling for the vote,
Yes.
and Commissioner DeBonne.
Yes.
And the chair votes yes, moving adoption of ordinance number 2024-008.
Thank you very much, Commissioners.
Thank you.
Thank you so much. Thank you, Kyle. We are now at item number 4. I see Kara's in. Thank you so much for being here.
Morning, Commissioners. For the record, Kara Cronin, Program Manager for Intensive Adult Services for the Behavioral Health Division of the Health Services Department. I got there in the end. Here to request permission to explore some funding from OHA to bring a position to the region supporting older adult behavioral health care and collaboration. So really requesting permission to enter into some more negotiations with them about bringing this role to our region.
Yeah, Kara, I guess my only question is, are we not already providing specific behavioral health services for older adults?
Yes, we are. And this role is more of a community navigator doing complex case consultations with PCPs, with area facilities serving older adults. So it's more like a community collaboration position and role. In addition, we plan to negotiate some direct service time that's going to bolster our older adult behavioral health team.
That would be for this fiscal year.
Yeah, they wanted to start in September, but
Okay. Yep.
time. So yeah, we would start this fiscal year. They do a prorated amount if, or whenever we
Yep.
get rolling. And then we have some wiggle room to renegotiate at the next biennium. We feel really good about the sustainability of this position.
Great. Well, and just acknowledging, coming in to talk about applying for a funding like this is just part of our kind of big fiscal picture, making sure we understand what's going on and then how to, close the loop on the annual review of the finances, making sure we understand what's going on. So I know this is step one and we'll see step two in the future also if it's successful. Yep.
Any questions?
Yeah, I want to know when the smoke's gonna leave.
Well,
I think that's on everybody's mind.
Friday at noon.
Friday at noon, okay.
Phone tells
Do you think, is that what your phone said?
Yeah.
Okay.
That's what they
good.
said on the radio this morning too.
Friday at noon. Well, they know when the wind is gonna blow and
That's it.
normally that's a really accurate science as weather goes. So, okay, well, we can all pray that and we can get some rain.
Yeah.
So,
So I promise.
okay.
Here we go.
I will write that down. I mean, it was just, it's really inconsistently just awful out there. Awful day. Yeah. Okay,
Rain or snow is what it's gonna take.
so is there a motion?
I'll move approval to apply for Oregon Health Authority Older Adult Behavioral Health Initiative funding.
And I'll second it.
Further discussion? Calling for the vote, Commissioner Chang,
Yes.
Commissioner Devon.
Yes.
And the chair votes yes, and I did write it down Friday at noon. Thank you so much, Karen.
Thank you.
Good
Yep.
news. If you write it down, doesn't that help?
Mhm.
All right, let's go to item number 5.
Chair, I'm just not sure if we have everybody here ready for the 9:30 item yet. I'm just checking to see who is all on deck. And is everybody here for the 9:30 item or are we waiting for,
Matt's here.
okay,
Sir,
it's just the one person. Okay, I didn't know if there was a broader team. So
I don't see.
On the staff memo.
that's what, yeah, I'm
Mm.
sorry. That's what
Yeah,
I
we
thought.
just
So
kind of
maybe
powered through the first
we're
few
running
items there.
well ahead of schedule. I didn't, yeah. So Commissioner, certainly your call if you wish to pause there for a moment. We do have another item that we were going to discuss at the end of the meeting that I could ask Eric Kropp to come down and just take a few minutes to summarize, or we can just postpone that until after the meeting as well.
I've got another other item update too.
Okay, why don't we do some other items? Since it would take some time for Eric to pop down. You want to go ahead with other items?
Sure, just update last night, Deschutes County Historical Society Board meeting. We passed a budget for the fiscal year and things are going well there, well-attended board meeting. So this is the Historical Society. And the message back to us as a board and as the county proper, there's a lot of thankfulness for the maintenance and utility costs of the Reed School building. So, as I say, around the board table last night was acknowledgement that, that facility is owned and maintained by the county and the utilities are paid. So that's just real appreciative. The budget rolls up to about $376,000 annually for the Historical Society. And the chili feed will be happening 6 and 7 November. So that's a lot of historical community event fundraiser for the Historical Society. So a chili feed in a couple weeks.
So what date is that?
November 6 and 7.
So there's 2 days for it?
Mm-hmm. So it's chili feed plus some raffle items and baskets. So it's a fundraiser for the Historical Society.
Thank you. Mr. Chang, did you have any updates?
I'll share that today there'll be a groundbreaking event out at the north end of Bend for the US Highway 97 North Bend Corridor project. I'll be giving some comments. All of us are, I believe, invited to that event. And then tomorrow, the Oregon Transportation Commission will be here.
And you're seated on that now? You'll be participating?
I am.
Very good.
And I will will comment that the other day on Empire, I thought I was gonna go to Sisters and I got on the Parkway. And no, I was going to Redmond.
Mm.
So unless I wanted to get up
Yeah.
and make a whatever turn in the middle of all that traffic going way too fast. So anyway, they've got to do some better signage. I will go and look at it again, but Empire, if you take that little right again to go north, don't do it if you're going to Sisters.
Yeah, well, pay attention. There's,
Yeah,
some-
you're not
there's some
gonna see that.
signboards out there, but yeah, we all got to learn about how to
Yeah,
get
no.
somewhere again.
Yeah,
There,
no.
there are places I've been driving to for 20 years that I now am Google mapping because I
Mhm.
just don't want to get lost in there.
It's, the signage could be way better, and the fact that they finished it 2 months earlier is remarkable. And they didn't finish it 2 months at a less cost, though. The cost apparently, according to the ODOT person at our COAC meeting the other day, was no, they still spent all that money, but they did it faster. So,
So back to Commissioner Chang's comments, you said an event today
yeah, 3 o'clock today.
and it's groundbreaking
Yes,
or
it's
ribbon
groundbreaking.
cutting.
We're gonna ribbon cutting.
ribbon? Yeah, so finishing the project.
Yeah,
Yeah, that's what I was just making sure. I was like, oh, is there something else starting?
If I said groundbreaking, I'm sorry.
Yeah, no,
Makes
yep,
sense.
finish. Yep, good.
maybe they're gonna cut the ribbons. to
One of
go
those
with it.
ceremonial things.
Yep. At the end of a project, not the beginning. Thank you.
And then yesterday I did go to a lunch and tea for M Perfectly. Ashley Smith runs that program. He has worked with approximately 48 women in our community that have either perhaps been in jail, have been homeless, and she gives them a whole new lease on life with her program. She's had 20 women actually graduate from the program. The presentation was amazing, and looking back at my visit to East Antler a month ago, clearly I saw a lot more women out there that were homeless than I had seen it in the past. So Ashley's program is really a need. And so it's the 4th year now that she's been doing this. She works with Shepherd's House. She actually works with our parole and probation department and a few other places. Anyway, hopefully she'll get some more funding to continue that mission. It's an amazing program. And I saw the women that she has worked with and the spark of life they have, and it really it was heartwarming. So thank you, Ashley, for all that you do.
Great.
Do we want to go? Is Emily here? Emily's here. Great. Okay. So you guys, okay,
So we were just rolling a little bit ahead of schedule, but thanks for joining us.
okay. Okay, we're going to get a drug overdose mortality crisis update.
Good morning, Commissioners. Emily Horton, Program Manager for Emergency Preparedness, Environmental Health and Engagement. And I'm here with our epidemiologist, Matthew Christensen, and he's going to do a presentation for us on kind of updating the changes in Oregon's overdose mortality crisis. So I'm going to let him take it away.
Good morning, Commissioners. I'm Matthew Christensen, an epidemiologist in the Deschutes County Health Services. Good to be with you this morning.
Yeah, thanks for joining us.
Absolutely. Thanks for the invitation. In the last 4 years, from 2020 through 2023, drug overdose mortality rates increased substantially in Oregon. However, Oregon is not alone in this regard. The entire West Coast saw large increases in the past 4 years.
I think you can move the slides on the screen by yourself.
Yep, I think here. Yep,
Yeah.
yep, okay. Thank you. Including California, Oregon, Washington, and Alaska, all saw large changes in the last 4 years. We're going to talk in detail about Oregon and counties in Oregon and here in Deschutes County. But a lot of the change in the last 4 years applies broadly across California, Oregon, Washington. All 4 counties saw large increases in the last 4 years. The information I'm going to share with you this morning covers 3 different perspectives. I'm going to share some national data to provide that overall larger context, state data, mostly Oregon data, and then local data, county data in Oregon, including here in Central Oregon and Deschutes County. During this 4-year period, Oregon moved from one of the lowest states in the nation to one of the highest states in the nation in terms of drug overdose mortality rates. Last year in 2023, we saw our largest single year increase in the number of people that died in Oregon. For the last 4 years, we've had increases year over year. And last year in 2023 was our largest increase. Here in Deschutes County, we have also seen increases in drug overdose deaths. Nearly all counties in Oregon, nearly all. There are a couple of counties that have not reported any drug overdose deaths in this 4-year period, a couple of our smallest population counties in the eastern. But it is accurate to say broadly, nearly all communities and counties have seen increases in drug overdose deaths in the last 4 years. Here in Deschutes County, our rate has tripled or doubled in comparison to other counties. However, there have been much larger increases, and we're going to look at some of those differences county to county. So not all communities have increased at the same rate, and that's a big part of the story, is there are certain communities that have seen much larger increases in the last 4 years than others.
Question.
Yes.
So drug overdose mortality, are we referring to opioids specifically or not?
No, it's all drugs. We're looking today specifically at what's categorized as unintentional. These are not including suicide overdoses. These are unintentional drug overdoses, often referred to as accidental drug overdoses, any substances, alcohol, and oftentimes it is multiple substances, methamphetamine, fentanyl, prescription opioids, heroin.
Great, thank you.
Matt, one other question about the distribution across counties in Oregon. If someone is declared deceased at a hospital, is the drug overdose death recorded in the county that the hospital is in, or do they attribute it back to where the person lives?
Good question. All of the information we're going to look at today is resident data. So the information I'm sharing with you is based on residents. So any county data, it's going to be Deschutes County residents, state data, Oregon residents. It's all resident. Yeah. And there is a data point on the death certificate that records both, whether it's a resident or whether this person died out of state or out of county. And so you can look at either, but we're going to look specifically at resident drug overdose deaths.
Thank you.
To begin on this slide, if you can see it, you see it on your screen. Okay, great. Okay. I'm used to like bigger screens, but I think everyone's got enough. We're looking at a long period of time. So this is perspective on 2.5 decades, 24 years, going back to the year 2000 up through last year, 2023. The green line represents the United States. The blue line is Oregon. And what we're going to talk about in depth today is the far right of this graph. That's the 4 years, the last 4 years, 2020. The blue line changed substantially. That's representing us. That's a nearly vertical increase in this long-term perspective. But that gives you a good impression about how much things have changed. In 2023, this is the first year Oregon has had such a substantial rate above the national rate. That green line represents the national rate of drug overdose deaths. And for the last 3 years in the United States, it's been flat. So 2021, 2022, 2023, the rate is about 30 to 31 drug overdose deaths per 100,000. And last year in Oregon, our rate was 39.5 drug overdose deaths, a large difference. That put us in some of the highest states in the nation as of last year. And we've never been part of that discussion. In terms of being, when you look at a map of the country, the West Coast and Oregon being part of the leading edge of drug overdose mortality, really until the last few years, the West Coast is starting to become part of that discussion in terms of the highest drug overdose mortality rates in the nation.
Yeah.
I want to draw your attention on this graph to the blue line from 2006 to 2018, that period. That's a pretty flat line for us in Oregon. That's our long-term history. For 13 years, we didn't see any change. Our rate was around 10 drug overdose deaths. And so for a long period of time, Oregon and also a lot of the West Coast wasn't seeing changes up until 2020 when things changed substantially. And then we've seen it every year since 2020.
Matt, I've heard people correlate the green line, the earlier rise in the eastern United States with the arrival of fentanyl. I mean, fentanyl has become a big thing on the West Coast just in the last few years, but it's been on the East Coast for a long time. Would that be a way to explain why the national rate was rising so significantly before it was rising in Oregon?
Yes, that's exactly accurate. There are other multiple drugs that contribute to drug overdose mortality. Fentanyl is the most lethal and the strongest force among those drugs, and it does drive up drug overdose deaths. So when those two lines separated in 2012, up until 2012, the blue line and green line, Oregon was tracking with the United States trend. This is when prescription opioids back in the 2000s and heroin and other drugs were contributing. Our rate looked very similar. And then in 2012, the two lines separate. We continue on our flat trajectory, and the green line is continuing upward. And what happened, our large cities on the East Coast and states in the East Coast and southern states, fentanyl started to arrive. I remember reading an article about Boston, Massachusetts back in 2016, and it was talking about something coming into Boston in 2014, and they were seeing a rise, and they identified it. They were able to identify it in toxicology test results. But it was new then in terms of illicit fentanyl and the amount coming in and the number of deaths that we're seeing. And that's what's happening with the green line. Certain states and cities in 2012, 2015, 2018, fentanyl's coming in, and you're seeing the national rate getting pulled up by what's happening. And it really didn't come to the West Coast until 2019, 2020, when our line starts to go up. And we've seen it come in large quantities. And so, yeah, that is, we're going to look a little bit later at the specific drug-related data, and it correlates very strongly, the rise in fentanyl to the rise in our drug overdose deaths. This is a map of the state of Oregon showing our 36 counties. And in a few minutes, I'm going to look at this 4-year period, and we're going to go through these maps. I'm going to explain them a little bit more in terms of the legend in that top left corner and how to make sense of them. There's a lot of information on these maps, and so we're not going to be able to, you can't soak it in this period of time. If you're interested, you're going to have a copy of this, and you can look year to year, county to county, and see how things have changed. But we will go through this in a few minutes. For now, what I want to point out is the 5 counties with that darkest coloring, that darkest shading. So we have 5 categories of drug overdose deaths, and the darker colors, the darker colored counties have the highest rates of drug overdose death. This is for 2023, last year. And we have 5 counties above a rate of 50 drug overdose deaths per 100,000. And so across the country, there are more than 3,200 counties And any county in the country above 50 is in the top 5% of all counties in the country. So as of last year in 2023, Oregon has 5 counties in the top 5% of the country in terms of county drug overdose mortality rate. So that's Multnomah County up in the northwest, Lane County, including Eugene, and then on the southwest corner, Jackson, Josephine, and Curry counties. They're not the only ones. They are the highest in 2023, but many other counties have seen increases that we'll talk about a little bit later. The next couple of slides, I'm going to just provide a little bit more detail about these specific counties, because this is where the changes happen most in terms of where in our state. This is for Multnomah County. On this slide, I limited the county size to 500,000 residents. So this is looking across the nation to our largest county populations above 500,000 residents. And so those largest counties, essentially it's our cities across the country with at least 500,000 population. These are the top 5 drug overdose mortality rates, starting on the left. I know it's Nashville and Davidson County, and I believe Philadelphia, both with a rate of 74. And then in the middle is San Francisco with a rate of, and that's San Francisco County, California, 75. And then Multnomah County with Portland with a rate of 77, second highest in the nation with this 500,000 resident population. And then you can see Baltimore City, Baltimore, Maryland, having a much higher rate last year in drug overdose mortality. Some of the highest right now in 2023 and for several years, the highest rates in the country are coming out of West Virginia, Washington, D.C., Maryland, Tennessee. We'll look at that a little bit later. But now some of the West Coast states, Oregon, Washington, Alaska, are part of that discussion too, in terms of the highest states with the highest rates in the nation. Here are the 5 counties that I pointed out on the map, and I've put in the detail in terms of the number of drug overdose deaths in 2022 and what it increased to in 2023. You can see from Multnomah County, they had a large increase in 2023 from their previous year, from 401 up to 615. I'm not going to go through every one of these county numbers. You can look at those details. I do want to talk about Jackson County a little bit, because Jackson County, occasionally we here in Deschutes County will compare ourselves in terms of different data points and different public health outcomes, because they have a similar population size. Their resident population, this is Medford as the largest city center in Jackson County. Their population is around 220,000. Our resident population is around 210,000. So because of that comparability and just the size, we oftentimes will look at data points between. So in this regard, Deschutes County looks very different from Jackson County. Last year, you can see in Jackson County, they had 122 drug overdose deaths and put them in this category above a rate of 50 drug overdose deaths. Here in Deschutes County, we had 24 drug overdose deaths. So the difference between Jackson County and Deschutes County, they had 5 times as many drug overdose deaths. You can think about this. We're only looking at mortality here in the beginning of this with these several slides. You can think about this as the tip of the iceberg in terms of the mortality data that comes from our death certificate. And then everything else in terms of underneath the water level that we don't see as clearly is drug distribution, addiction, use, non-fatal drug overdoses. So looking at the tip of the iceberg, what happened in Jackson County was 5 times larger in terms of mortality. Very different experiences in the past 4 years between Jackson County and Deschutes County. On this slide, this is where I make the statement we've moved from one of the lowest in the nation to one of the highest. And let me explain what we're looking at on the far left of this in 2019. Oregon ranked in the nation at the 22nd percentile in terms of our drug overdose mortality rate as a state in 2019. And then in 2020, 24th. So we're in the bottom 25% of all states. That was our rate of drug overdose death. And this is at that time period, remember that 10-year period from 2006 to 2018. We aren't seeing a lot of change. And that's the end of these years here. And then we get to 2021, 2022, we continue to move up relative to the national picture so that in 2023, we're now at the 76th percentile, where we've moved from the bottom 25% of the country. We're now in the top 25% of the country as of last year as a state rate. And you'll see on the next slide that Washington has moved the same way. In 2023, they're a little bit higher than us. Alaska also is even a little bit higher in terms of the picture. On this graph that I'm referring to, this is all 51 states in the nation. These are drug overdose mortality rates per 100,000, and all states are listed. So I want to point out where the number 40 is, about 3/4 of the way up. That's Oregon. That's where we rank currently in the country. We've never been above the 50 percentile. Our history is below the 50th percentile, down at the 25%. This is the first year we're in this group and the conversation now of top. But you can see that Washington ranks is about 3 or 4 states higher than us on that graph. And then Alaska is also about 3 or 4 states even higher. And they've also not been part of this. This is new for them as well in terms of this national picture and having some of the highest rates in the nation. On the far right, I believe that is West Virginia with the highest rate in the nation. And then Washington, D.C., you can see is second. In the middle of the graph is 30. That's the national rate, or in other words, the national average, half of the country above 30, half of the country below 30. And then at the far left, Nebraska with the lowest rate in the nation as of last year. I'm going to go through these slides now. This is for this 4-year period from 2020 up through 2023. I'm going to take a little bit more time. There is a lot of information on these slides. If you're interested, feel free to look at them a little bit later when you have the time, and you can soak in some of the information. I'll explain it. Yep, there you go. Awesome. Yep, because it's good. I really like the maps. It displays a lot of information. And you can see things, the boundaries of counties that are similar. So, for example, one thing I learned when I first saw this, that whole southwest corner, just looking at data points or a graph, you don't see how the boundaries in the region, it's not just the individual counties on a data. It's like, oh, wow, the whole region has seen increases in that southwest corner below Lane County. So, with these 4 maps that we're going to go through, these are drug overdose mortality rates per 100,000 for the county. You can see that on the right-hand side of the state for our 36 counties, there's a lot of counties that have none of these shading. The 5 categories goes from a light tan color to that darker brown color. And a lot of the counties in the eastern half of the state, we weren't able to calculate these rates. And the reason we weren't is because there were just too few numbers. The numbers are too small. Rates get unstable. And so our cutoff point was 10 drug overdose deaths. All of those counties where we don't have any colors, you can see that underlying terrain, there were less than 10 drug overdose deaths in those counties. That means all of the counties on the western half of the state of Oregon, there were at least 10 drug overdose deaths, and we were able to calculate rates in those counties. In the top left-hand corner, the legend, we have 5 categories, and I'll just go through this quickly. It's from the lighter colors are lower rates, and as the colors get darker, then the category of rate increases. And all four of these maps go together for this 4-year period. The legend doesn't change. The idea is you can flip through the maps, and the only thing that's going to change is the color representing the underlying rate. The actual categories and the way we've got it set up are consistent across all the 4 years. Let's see, you can see what the categories are for the 5 colors, so I won't go through that. I've explained the counties that don't have any coloring. And then the bottom of the legend in that top left corner is the state rates for this 5-year period. So you can look at county-specific rates in comparison to the statewide rate if the county is above the state or rate or below the state rate. Here in Deschutes County, we have always been below the statewide rate every one of those years. So this map is for 2023. Our rate last year was 12 drug overdose deaths, and the statewide rate last year was 40 drug overdose deaths, so or 39.5. So I'm just going to flip through these now, and you're going to notice that things get lighter as we go back in time. For 2023, this is 2022. We only had one county that was above 50 in 2022. That was Multnomah County. 2021, and then in 2020. So things look very different. Back in 2020, we have 4 counties that are in that second level, the second category with a little bit darker color. Otherwise, all of the counties are in that lowest category. So just from a change in colors in the past 4 years, this explains some of what happened at this 50,000-foot level looking down at the state of Oregon.
And for the video recording, could you just scroll through time?
Oh, yep, I did a little fast there. Well, let's go back and I will. Yeah, good idea.
It's a really shocking visual to see 2020 and then
Yeah, 2020, right? Thank you. Yep, 2020.
21, 22, and 23.
So a lot of counties, we're focused on those 5 in the darkest category, but a lot of other counties on the western half have also seen substantial increases. I want to talk a little bit about Central Oregon here at this point while we've got the map up and we can see Deschutes County, Crook County, and Jefferson County. In 2023 and prior, Deschutes County and Crook County we've had some of the lowest rates in the state before 2020 and even since. Even though we've seen increases here too, we continue to have some of the lowest rates in the state. Deschutes County and Crook County looks more like the eastern half of Oregon that have seen less increases. Jefferson County, the last couple of years, 2023 and 2022, looks more like their neighbors. As you can see, they share borders with, to the north, Wasco County. So it's not, here in Central Oregon, our mortality numbers are not all the same. I do want to say, though, that I recognize our Deschutes County medical examiner. They've recently started sharing preliminary data with us, and so we're able to track in a timely manner drug overdose mortality here in our county for 2024. And it looks like 2024, our current pending number is going to be probably our highest number of drug overdose deaths this year. Right now, we stand at 27 drug overdose deaths in Deschutes County. That our rate, we calculate a rate to compare, is still going to be low. It's going to be probably around 13 at this point, but we still have 2.5 months left for 2024. So currently, yeah, and that's our highest so far we've ever had.
Jefferson County, because when I came out of Deer Ridge in July of 2023, they actually had a billboard up that I had been asking for in Deschutes County that said fentanyl was killing, and the leading cause of death from 18 to 45. So we saw it when we came out, and I was like, oh my gosh, they had, Dr. Baker really has tried to really engage his community. And, it's really disappointing to see that their number is so high. but he does clearly know the situation.
Yeah, yeah. I've spoken with the public health director in Jefferson County and shared this information with him as well.
Oh, good.
It is important to note that with the population overall in Jefferson County and Crook County, it's around 25,000. And so they are much smaller than us here in Deschutes County. So they're more susceptible to one or two additional drug overdose death. Their rate goes up a lot higher when you calculate the rate per 100,000. That doesn't diminish it. It's just you have to be careful when the numbers get small. But it is certainly valid that in the last couple of years, Jefferson County has had a higher number of drug overdose deaths than Crook and Jefferson. But it looks like this year in 2024, our numbers are also have started to increase with these preliminary data we're getting from the medical examiner.
But for any given county, until they hit 10 total for the year, they're not even going to show up. There's not going to be any shading.
Yeah. I don't report on a map like this, or I just wouldn't share in terms of a rate. I would be willing to talk about the number of deaths, but you can't compare numbers in a county because they're all county different. But the other rate gets unstable if you try and calculate a rate when the numbers are too small. So that's why Crook County doesn't have a rate in 2023.
I was working last year on recriminalizing drugs and Measure 110. I actually talked to people from Harney County, and I don't believe they'd had any fentanyl issues in their county as of last year. For Commissioner Doro, maybe that's changed now. But.
Yeah, I can't speak to their county specifically. I know that there are 2 or 3 counties, and I don't know if this is Harney or not. But there are 2, 3 counties that have not reported any drug overdose deaths in this 4-year period. But all other counties, so that puts it around 30, 32, 33 counties out of our 36 in this 4-year period have seen at least some increases in the number of people that have died from.
Matt, if you look at this time series from 2020 to 2023, it looks, I mean, if this was a disease, or if you call this a disease and you look at this as an epidemic, it looks like basically the infection rate is spreading across the state and has kind of increased all around Deschutes County, which would lead me to believe that there'll be spillover effects from our neighboring counties. Maybe, and seems like we're already seeing some of it, but do we have any way to kind of estimate or predict essentially when that will peak and then level off or decline, that effect, or is that something we can only do in retrospect?
Yeah, I don't know of a way to estimate that. I've thought about this a lot when I first put the maps together, and I saw that we share the border with Lane County, and then they consistently have some of the highest rates, but we have the mountains between their population center and our population center, and I think that is a contributing factor. But I've thought about it as a disease model too, and it is. You don't see disease spread in a population like you see this and then leading to mortality and morbidity as quickly as it has. This is a unique, you can think about it as a disease, but it would be overwhelming if this was a communicable disease and we were seeing this kind of a rise in a short period of time, to compare it to a disease model and communicable. Yeah. Let's see. I don't think I have anything else on the map before we move back. I'm going to, on the next several slides now, talk about the drugs. We haven't talked about the drugs yet. And so we're going to talk more in more detail about the drugs and what some of that data looks like. On the left-hand side is representing Oregon, and on the right-hand side is comparable for the United States. And so the green line on the left for Oregon is comparable to the green line on the right for the United States, and same for the blue, yellow, and red lines. It's meant to compare Oregon to the U.S. And you can see right off the bat, the lines look very different for Oregon and for the U.S. Let's start with the green line for fentanyl. On the far left for Oregon, 22% in 2018, 22% of our drug overdose deaths came back positive for fentanyl in Oregon in 2018, and that it decreased a little bit to around 20% in 2019. And then you can see from 2020 forward, it's increasing. So that is strongly correlated with our drug overdose mortality rate. In the past 4 years, our rate is increasing higher. Well, it's largely correlated by and driven by that rise in fentanyl. So these are our toxicology test results. A blood sample or a urine sample is sent to the state lab after the drug overdose death, and there is a confirmation as to the presence of drugs and in what amounts. And so with this graph, I'm only showing if the drug was present, if that confirmatory test was positive, and each year how that correlates to our death numbers. So you can see for that green line for Oregon on the left in 2023, 77%, over 3/4 of our drug overdose deaths were positive for fentanyl. And then looking at the United States, the green line, it starts a lot higher. In 2018, half of all drug overdose deaths in the U.S. were positive for fentanyl. And so that's part of what Commissioner Chang mentioned in the beginning about before 2020, fentanyl hadn't really arrived here in that earlier graph we were looking at. And then fentanyl has really started to arrive since 2020 in larger, consistent amounts. The green line continues for this 6-year period for the United States, ending with 74% of all drug overdose deaths in the United States in 2023 being positive for fentanyl. Let's move to the blue line, methamphetamine. For Oregon on the left, methamphetamine for many years prior to 2020 and continuing has been the primary drug of concern here. It is generally in the western states a lot more common, a lot more prevalent, and it has been contributing to our drug overdose deaths for many years prior to 2020. So you can see in 2018, 52% of our drug overdose deaths were positive for methamphetamine. And then that increased over the 6-year period to, I believe it's, is that 67% for the percent of drug overdose deaths positive for methamphetamine in Oregon. And then compared to the U.S., that blue line is a lot lower. There are some parts of the country, regions, and states where methamphetamine is a less part of the picture. And offsetting that is the yellow line. The yellow line is cocaine. And so you can see for the United States, blue is lower, methamphetamine is lower nationally, and cocaine is higher nationally than Oregon. Looking at the yellow line for Oregon on the left, we haven't seen a lot of change there. About 10% of drug overdose deaths are positive for cocaine. I do want to mention that the reason we're focusing on these 3 drugs, these are the 3 most lethal drugs and common drugs contributing to the drug overdose deaths. These aren't the only ones. This picture can get more complicated if you are trying to include all substances. Usually there are multiple substances identified after a drug overdose death. Rarely is it one. Occasionally it is, but oftentimes it's 2, 3, 4, and even more substances. But these drugs we're focusing on because they're the most prevalent now and the most strongly correlated to causing the drug overdose deaths.
Dr. Christensen, did you attend the DEA, et cetera, and law enforcement from all of like Eastern Oregon was here a couple of Fridays ago? You didn't come to that Friday morning meeting, did you?
I didn't. No, I didn't.
It was honestly fascinating. And then last Friday morning, I was at a DUII state advisory committee, and everything you're saying, yes, it's like, it's and meth. Yeah. It's
I have seen some of the code data that they're collecting in Central Oregon around the fentanyl arrests. And so they've updated that information. It is fascinating to look at the number of arrests and the number of pills that have been confiscated during this time period. It's also increased many times in terms of just the number of arrests and the prevalence.
Well, it'd be interesting just for what your presentation is and showing how we're rather unique and we're definitely going the wrong way, to get that information out to those people.
Yeah, good idea. The last thing I want to talk about on this slide is the red line. The red line's a little bit different than the others. I included it on this graph because this is a new phenomenon we're just seeing in the last 2 to 3 years here in the West Coast. This isn't just Oregon. We're only looking at Oregon data on the left-hand side, but the red line represents those people that were positive for both methamphetamine and fentanyl together. And so look at 2018 and 2019 for both the US and Oregon, the red line is down around 5-6%. It was not common several years ago for these two drugs to be used together, either knowingly or unknowingly. They weren't mixed together. But now in Oregon, as of 2023, nearly half of our drug overdose deaths are coming back positive for both meth and fentanyl together. Yep, new and very concerning. They're both very lethal, and they're now being mixed together again. Oftentimes it's unknowingly, but we don't know how much it's known or unknown that's happening.
So when you mix the meth with the fentanyl, does the Narcan still combat that? Can it stop the overdose?
Yeah, Narcan will, anytime there is an opioid on board, it will have an impact on the opioid. It's not going to have an impact on non-opioid drugs. Yeah. So. I've been giving this presentation for off and on over the past year for in several audiences, and I'm really happy to give you the next few slides because there is some good news that's just we've learned about the last few months. And so we're starting to see a change. Everything we've been talking up until now is coming from our death certificate data. We've been looking at mortality. The next slide, we're going to look at emergency department visits, people who survived the drug overdose and ended up in one of Oregon's emergency departments. And these data are showing a decrease in the last several months from last August. And we're also seeing it here in Central Oregon, looking at our emergency department visits in Central Oregon. So this is the graph. It's looking at the same time period we've been talking about, the last 4 years. This goes through July of this year. These are monthly numbers of emergency department visits for opioid overdose. And so you can see on the far left in January of 2020, is it 293? I believe. I can't see the.
Yep, 293.
Thank you. Yeah, I'm going to estimate those numbers. So these monthly numbers in January of 2020, and this is statewide across Oregon, 293. And then you can see up and down, but an increasing trend. We've already looked at the mortality data for this 4-year period, and our rate increased. And the emergency department increased not quite at the same rate, but it is increasing, and it is what we expected. You can see the point there on the far right, August of last year. That was the peak number of emergency department visits for opioid overdose. I think it's 646. And since then, about a year ago, things have increased or decreased substantially, excuse me. The last data point is for July of this year, statewide opioid overdoses, and you're going to have to read it for me. 334?
39.
339?
Isn't the fact that we have Narcan so many places now, wouldn't that be impacting this number on some level?
It's hard to estimate. So these are non-fatal emergency department visits. So it's going to impact the mortality. That's really when, and there could be some impact here in terms of people deciding not to go to the emergency departments. So if they are reversed with Narcan and they're revived, they might decide not to go. But I don't think so. We're going to look at a couple more slides. But I don't know. We don't really know. This is brand new. I want to make that really clear. I don't know. And
Really honestly appreciate is the fact that these are 2024 numbers that you're giving.
awesome. Me too.
I was just for the state, we were looking at numbers from 2022. I'm like,
Yeah.
oh, please. As you said, we've had an epidemic and So thank you for bringing 24 numbers.
Yes, yeah, absolutely. That is a challenge and it is a struggle. That's one of the reasons we're so grateful for our local medical examiner is now sharing that preliminary data. So we know what's happening this year. And that makes a big difference for our ability to act responsibly. And this is a benefit of this system. For emergency department data, we get it updated every 24 hours. So we know what's happening regarding our emergency departments in the state. This next slide is sticking on this same idea of did something happen? So our ED data are suggesting something happened regarding opioid overdoses after August of last year. And it's been decreasing since. After I made that graph, I put together this graph prior to the Public Health Advisory Board meeting a month ago. And I was interested to see if I could see a similar pattern. So what we're looking at with this graph, we're back to the national data. And I broke down the 2023 mortality data. These aren't rates. These are numbers of drug overdose deaths every month in the US. So prior to August of 2023, we were having about 8,000 to 9,000 drug overdose deaths every month in the US, pretty consistently. After August, we dropped for the first time below 7,000, and we're staying below 7,000. So what I want to point out is this is also suggesting that something happened after August last year.
2023.
What?
After August 2023.
After August 2023, yes. Yeah, yeah. I only have access to this data that goes through December of last year. So I can't speak to any national data or mortality data, but so we have two different data sources, emergency department data and these mortality data that are both saying after August of last year, we're seeing a substantial decrease. Both of these things, these aren't small differences. We're talking about thousands of deaths nationally during this time period that didn't occur in those last 4 months. And with the emergency department data, nearly 300 fewer emergency departments visits every month in our state now, compared to what was happening a year ago. So large decreases. It's very, very positive. No, exactly. Yeah, I don't want to. It is. You're right. We're at a.
Well, it's still really tragic if it's your
It is.
child that's overdosed and died, and you're
It is. I agree. Yep. And I do want to be careful there because it's certainly, I don't want to suggest it's over or it's past or it's not coming back because we don't know. This is very preliminary, but we haven't really had good news for quite a while and for the past 4 years. Our story in Oregon is up, 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 up. What this is suggesting is maybe in 2024, we're not going to go up even further. I don't know if it's going to be level or if it's going to decrease a little, but we are at a very high level, as I've been talking about up until now. We're now some of the highest states, with some of the highest states in the nation. So I certainly agree with you, Commissioner Adair.
Matt, so when you showed us this emergency department visit slide for the state of Oregon, it went up through June 2024, shows a very exciting, promising trend, a positive trend. Do you have any, and then you also shared that we know for Deschutes County, for the year 2024, our overdose deaths are still likely to climb a little farther.
Yeah.
But do you, so that, I mean, kind of following this slide, do you have any sense of what the trend is for Oregon as a state for overdose deaths? I mean, I would hope that the overdose deaths for the state are declining as the overdose emergency department visits for the state are declining, but
No, exactly. That is the implication here. I don't have a mortality data for Oregon for 2024. We will have those data early next year. That picture will start to get clear in March, April, May. It takes the mortality. This is coming from our state death certificate. It takes a while to complete those each state, and then they're reported nationally, and then they're released. That's why we have older data with our mortality data, but we'll know what happens in Oregon early next year as to if we actually did see a decrease. But I do want to suggest strongly that these ED data for opioid overdoses are correlated with our mortality data. And so this much of a decrease in ED visits certainly suggests that we may see a decrease or not an increase, at least, in our deaths in 2024. Yeah.
we may have a little bit of a lag in Deschutes County behind the rest of the state in terms of leveling off and declines.
Exactly. Yeah. Our numbers in our county, even though we have some of the lowest rates still in the state, we already know that this year is probably going to be our worst in Deschutes County. We're sitting at 27. We've never had 27. Our previous high was 26 in 2022. Last year we had 24, 26 drug overdose deaths in 22. We're sitting right now. These are not final data. These are preliminary. It takes a while to finish those death certificate data, but if these numbers hold, it looks like this will be our highest year, excuse me.
See, I was always getting the numbers from Best Care from Rick Telephon. And I believe they had 3 people overdose. These were people that were being taken care of by Best Care, and 3 people overdosed and died in 1 week a year ago. So, and I know it's not just for Deschutes County. So it gets a little bit complicated when you start comparing.
Yeah, yep. You do have to be very comparable. The data source, and if you can compare it, you do. That's a part of it.
Rick was saying last year was that historically for 20 years, they had only lost like 1 person a year. And then last year, people that were under their care were going back and overdosing and dying. So it made them rethink their entire model on what can we do differently.
Mm-hmm. Mm-hmm. How am I doing on time?
We set you up with an hour.
Okay.
So, and you started at 9:13.
Okay.
Didn't he start at 9:30, Emily?
Okay.
Yeah, you've got.
All right. Awesome.
Time.
So you got a bonus 15 minutes and
Okay. We're going to keep great. Got plenty of time. So this slide is for methamphetamine and stimulant-related emergency department visits. So the reason I pulled this data and I'm sharing it with you today is because a question I had, once I saw our emergency department visits decreasing for opioid overdoses, I thought, well, is it also decreasing for methamphetamine? Those are the 2 primary drugs that are correlated with our death rate. And so we're seeing a decrease with opioid overdoses. We're not seeing a decrease with our methamphetamine related emergency department visits. This is the same time period. These are monthly numbers for the state of Oregon emergency department visits. You can see that there is no drop off for the last 2.5-year period there. We're sitting at around 1,200 emergency department visits in the state of Oregon for methamphetamine. So this also tampers the idea of good news that, well, it looks like it's only related to fentanyl. It's certainly good news, but not on the methamphetamine side. This is happy to share this data with you. This is specific to Bend City. This is wastewater data that we've been collecting. We started with COVID-19. We started monitoring our wastewater data for the presence of COVID-19 a couple of years ago. And then about 7 or 8 months ago, we started testing our wastewater data for the presence of fentanyl and methamphetamine. And so what we're looking at here is fentanyl in the wastewater for the city of Bend. A couple of things I want to point out. The blue line at the top, that represents an estimate of the national presence of fentanyl in wastewater. So like a national rate of fentanyl. So we have a lower rate here in Bend. That's consistent with our low overdose mortality rates. And it's decreasing during this 6-month period, going back to January of this year. Presence of fentanyl in our wastewater in Bend is decreasing, which is also correlated with the idea of the emergency department data showing fewer or a decrease in the opioid overdose visits. Sticking with our wastewater data, we're not seeing a difference related to methamphetamine. We have a higher rate of methamphetamine in our wastewater here in Bend, in the city of Bend, compared to the national estimated rate for methamphetamine, and we're not seeing a decrease on the methamphetamine side. So it's a pretty consistent pattern that we've seen so far, that we are seeing positive news around opioid and fentanyl decreases, but not on the methamphetamine side. I'll go through this quickly because it will wrap up our discussion about drugs. I wanted to verify and confirm that Deschutes County looked similar to Oregon's overall pattern. So I just put this slide together to confirm the fact, and it does. This meets the expectation I had, but I felt like I needed to actually pull the data to show what the numbers are. So we're looking at the last 3 years, 2021 through 2023. Looking at Deschutes County on the left, I believe it is it 66%? 66% of our drug overdose deaths in Deschutes County were positive for fentanyl. And then you look at Oregon in the center, it's 67%. And that was the point of putting this together. Do we have a similar pattern as the overall state data? And we do. And it's what we expected. It is what we expected. But this just confirms the fact that, and the same for methamphetamine in terms of our data looking similar to the overall state data. And we already have mentioned previously that the national data is much lower on the methamphetamine side compared to here in Oregon. As an epidemiologist, I feel the need to put this slide together because what we've been talking about here is on the problem side of what's happening with drug overdose in Oregon and here in Central Oregon, Deschutes County. And so the question is, well, what is happening? What are we doing about it? What can we do about it? And there is a lot happening. We're looking at a 20,000-foot level with this slide to at least address the overall strategy for impacting drug overdose mortality risk, and that is to impact the drug supply and the drug demand. So on the left-hand side, law enforcement agencies are primarily working to interrupt the supply of drugs, and this is internationally, outside of the U.S., also at a national level with federal law enforcement and state law enforcement and local law enforcement, oftentimes partnering together. And on the right-hand side, working to interrupt the demand for the drugs. And so this is public health agencies, treatment providers, behavioral health, mental health treatment providers, recovery services, and healthcare providers. Again, a lot is happening on both sides of these things, specific strategies. This is a difficult area to impact, but there is a lot of work attempting to impact and reduce mortality risk on both in terms of limiting the drug supply and also limiting the drug demand. In conclusion, just a few thoughts here. Deschutes County has seen increases in the last 4 years, but we have consistently had some of the lowest rates in the state of Oregon. We talked about the 5 counties in Oregon that now are among the highest county rates in the nation. And then the emergency department data, which is now suggesting that we just talked about, that the opioid overdoses are starting to reduce in our state, which implies that if that trend continues, my last bullet point here is if that trend continues, we're unlikely to see a 5th consecutive year. I started this presentation talking about the last 4 years, which is every year higher, higher, higher in Oregon and the West Coast. If this trend continues, I don't think we're going to be higher even again in 2024. We won't know for sure until early next year when those mortality data are made available and they're finished. Just to for information, if anyone is interested, multiple data sources I pulled for this information. And then I want to just say thank you very much for inviting me to share this information. I want to recognize there are many individuals that I work with that are working in this same area. Every couple of months, we have a Central Oregon Overdose Prevention Response Coalition that meets. There are representatives from Deschutes County, Crook County, and Jefferson County. Also, where I work in Deschutes County Health Services, we have really supportive leadership and program staff that are working in this area to reduce drug overdose mortality risk. And I've already mentioned our Deschutes County Medical Examiner, that they have agreed to partner with us and share their data. And that's been a real game changer for us. Prior to December of last year, when they first started sharing the data, we didn't know what was going on in Deschutes County until 18 months after the fact. Now we know, yeah, exactly your point about later data. You can't really take action when data is that old. Now we know within a matter of a day or two, or at the most a week, of when things are happening here in Deschutes County, which allows us to act a lot more responsibly to try and reduce risk. That's all I have. If there are any other questions, happy to try and.
I just want to make a comment. The Governor's Advisory Board on DUII is going to have their statewide meeting in Bend, April 3rd and 4th. And Chuck Hayes is chair of that group. Anyway, I was talking to him and I'm hoping that he's going to bring in Kevin Sabet to be the speaker for that venue. And, you know, Kevin served in the White House with Obama and with President Bush over drugs. So Chuck thought maybe we could get him to come here.
Okay.
I follow him and what he's always talking about. It's so many people don't seem to understand the dangers. But the actual meeting here with the DEA showed fentanyl being made in Mexico in like dirty barns. I mean, they were like dirt barns. And, you know, if you saw that, you would really think twice about putting something in your body. The conditions were horrific. And apparently that's where it's made.
I'm sorry, I missed that.
Oh,
sounds like it was a good.
Yeah, it was actually, I just accidentally ran into Andrew Doyle, who works out of, you know, our DA's office, and said, "Oh, Patty, aren't you coming to that meeting?" And so I was really happy that I was able to listen to part of their presentation.
Great.
Yeah.
Well, this is a great example of public health. You know, this is everybody. This is our whole population. And putting these numbers together like that really are valuable for everybody to be able to see and understand the trends. And thank you for finding the fact that maybe we've peaked. We'll see where that goes. So one of the other thoughts is the medical examiner work group at the legislative level is talking about adding capacity, possibly a new facility in Lane County. So this is medical examiner autopsies, but also toxicology. I think that's where this would cross real well with this. So Association of Oregon Counties will have an update on that here. And it's a legislative effort. Obviously, you know, if we had lots more money, we could go do something here, and that'll be the message to the legislature. But I know those toxicology, official toxicology information is very valuable. So I'll be an advocate to, you know, just get the throughput up. That's the key to this whole thing.
Yeah, thank you for that, Commissioner DeBonne. I agree fully. One of the bottlenecks with information is the toxicology testing. Sometimes that's taking months to get those results back, and that's part of the delay in getting that information. So if more capacity would be awesome.
And when you hear about it, it's kind of Clackamas County is the facility that is the main facility. And if there can be something in Lane County, that's going to be kind of the Eastern Oregon go-to, because we saw the phenomenal numbers in Multnomah County, and we want to, as I say, population health for everybody, and information is going to be good here. So yeah, that Lane County effort would be a real good one for the legislature to dive into.
I wanted to mention a couple of things. First off, thank you for this excellent presentation. It really helps us get a better understanding of the situation and what we need to be doing to address the situation right now. When Dr. Christensen presented this information at the FAB a month ago, the slides on wastewater data prompted a whole discussion about homelessness and addiction in our community. I pointed out, well, people who are unsheltered homeless are not contributing anything to our wastewater system in the city of Bend. So that information wouldn't be shown. That wouldn't be any use of drugs in the unsheltered population might not be reflected in the wastewater data, which led to an additional discussion about the number of people who are struggling with substance use disorders in our community, and also the percentage of people who the percentage of mortalities that were people who were unhoused. And Dr. Christensen, could you share some of that information about housed versus unhoused people in the mortality data?
Yeah, yep. I've thought about that conversation as well afterward, because it was kind of spontaneous and led to a couple of questions. I did go back and look at the data. So about 60, our current number in Deschutes County is 27. These are preliminary data. And of those 27, 60%, about 60% are housed or residents, either renting or they own their house. And that's 60%. 10% of this were missing data. And so that leaves 30% of these deaths that are either in shelters or a hotel or with a friend, or they are on the street or in a car. So about 30% are in those categories outside of the house population. So, our number's 27 and 60% housed. 10% missing, and 30% are being reported as somewhere in that transition of shelter or hotel or on the street or in a car tent.
What if they're here from Portland and they overdose and die here in our hotel? Does that number go in our county?
No, if it's resident. Yeah. This is part of the work of the death certificate and part of that investigation. Who is this person? Yeah.
No.
It's their resident status. Yeah, right. Exactly. And that happens all the time. We have residents that die in Portland and they're counted here. There are residents. And so, everything I've shared with you is about a resident. Yeah. Mm-hmm. Mm-hmm.
No, well, what's really important about this is that there are people in our community who really conflate addiction with homelessness. And it's really important for everyone to understand that there are tens of thousands of people who are struggling with addiction in Deschutes County who are not homeless. And that, yes, there is a portion of the homeless population that is struggling with addiction too, but the two are not completely overlapping. And there is a massive number of people who are struggling with addiction in our community who are housed. And so as we engage in discussions about homelessness, it's really important and about combating addiction and drug overdose deaths. It's really important to recognize that distinction. The other thing I'd like to mention is this story about, and the data, the national data that you've presented help us see that fentanyl is a big driver of our recent overdose deaths. Fentanyl has arrived on the West Coast fairly recently, and we're also seeing that emergency department visits, at least, maybe not the mortalities yet, but the emergency department visits have been declining for a little over a year at this point. If the mortality data demonstrate a similar trend for the state, from a policy perspective, I think it's really important for all of us to note that this decline predates the passage and implementation of Measure 110 reform. Because a lot of the concern about this overdose death epidemic is a huge part of what drove the Measure 110 reform in early 2024. But if emergency department visits and deaths have been declining for a year, then it'll be really important for us to recognize that hopefully House Bill 4002 and deflection is going to play a role in reducing overdose deaths. But it's quite possible that trend had started even before the implementation of that policy. And for that, if there's something important there, if there's key prevention activities, interdiction activities that are driving that decline, it's very important for us to understand what those are, so that we can amplify them.
Agreed. Yeah. At this point, I don't think there's any understanding about why that data are showing a decrease. I'm sure it's being worked on at universities because this is new information. You may have seen headlines, just national headlines that are saying a decrease in the national mortality, and they are working, I can guarantee it, trying to what's happening? Is there something causing it? And so I think early next year, in the coming months, we will get a clearer picture as to if this is a real decrease and it's going to be sustained, and then why, what's happening.
But I do feel that public information was out there. We actually had a marijuana presentation a couple months ago, and I had a county employee that said they had no idea from our doctors. They said they had no idea what marijuana could actually do to the system, and the fact that we have, I was told, six youth under 16 in Crook County, small Crook County, that had psychotic disorder from excessive marijuana use. So the drug information is getting out there. I can't tell you how many times I testified a year ago. Our lobbyist said we weren't going to change Measure 110. And guess what? We actually, they did listen to people. I mean, the fact that we have babies born in our hospital that have the effect of fentanyl. I mean, the implications of those children's lives, they're forever touched in many cases. So I just feel like we did so many public information with the testimony, with all the different people. We're really fortunate here. We have Ideal Options here working, and I feel like they were on the forefront. They were testifying too about Measure 110 and that it really needed to change. So I would think it would be a combination of factors.
Well, it definitely, if some of these prevention and education efforts are part of what started this trend, it'll be great to understand, to try to understand that over time so that we know what's effective and what's not.
Absolutely. Yep. I couldn't agree more. And then I am confident it will come. It just, that information isn't known yet.
Yeah. Yeah. One last question I wanted to ask was, to go back to this national, national versus Oregon 24-year time frame. So the nationally overdose mortality rates are flat to declining. And we talked about how fentanyl came ashore in the eastern United States and rolled across the country. If these national rates are declining, it would suggest that other states have they had fentanyl early, had problems early, and for whatever reason, fentanyl overdose deaths are coming down there because, I mean, that declining green line includes Oregon and Washington, California, where it's still been going up the last couple of years. So, I mean, this is there's enough decline somewhere in the United States to swamp out the increases that we've been experiencing. So, I mean, my hope would be that whatever is causing fentanyl related overdoses to decline in other parts of the country will arrive here at some point as well. And I'm curious whether you have any insights on that, whether whether that's kind of a standard pattern and that's what's going to happen, or whether we need to work in certain ways to make that happen, or anything like that.
So the last 3 years, that graph that you're showing, the green line, for the United States is relatively flat. I think the rate was 31, and then last year it dropped down to 30. And the reason it decreased a little bit last year was, you'll recall the data I showed you with the monthly numbers in the United States, around 8,000 to 9,000 drug overdose deaths. The last 4 months, it decreased so much that that's where that decrease in the 2023 number is. So something happened after August.
Okay.
And it's specific to that. And that's about as much as I can say, the idea of something happened. The data clearly indicate, it's as our ED data do, that national deaths after August have started to decrease. And that's what some of the headlines are that are now in the media, that the national mortality is coming down. And it is inclusive of us. I think our emergency department data say that it certainly is happening here in Oregon. They are strongly correlated. I'm not sure, did that address your question?
So it sounds like we're tracking the national trend and maybe behind some of the other states, but hopefully on the same trajectory. I mean, is that?
I'm not sure. I'm not sure I follow. Can you give me a little more explanation there in terms of
You may have on
interpretation?
Do
you have additional thoughts?
Yeah, hi, Jess Nyworth. I am with the Prevention Health Promotion Team at Deschutes County Health Services. I just wanted to share something that Matthew referenced and both Commissioner Chang and Commissioner Adair alluded to is because we are seeing declines across the rest of the country, there have been proven results of our efforts. So prevention, health promotion, harm reduction, and treatment services, there are a number of best practices that we know work. And you actually have funded our team to put those practices into place since last year. So when we look at harm reduction services, making sure that all folks have access to Narcan, access to connection to treatment, we are looking at treatment services and including increased linkages to care. So those who are in the emergency departments have access to treatment immediately. We're looking at improving services in our jails for folks who are leaving jail, but we're also looking at health education. So what does our health education for our schools look like? So we have a really comprehensive health education curricula and approach in our Bend Lapine school districts, thanks to the Healthy Schools program. We also work with our Redmond and sister school districts to improve their health education and systems to support young people. We are working with our colleges, local colleges, to ensure that they have both prevention, harm reduction, and education materials, and linkages to early screening, brief intervention, and referral to treatment when they need it. We know that these systematic changes do have an effect and bring down those numbers of folks who have a substance use disorder, who are using substances, who are in need of emergency services, or who are dying by overdose. We've seen this in the rest of the country, and we've been able to put those into place here, thanks to you all funding our work and funding health services work, and we'll continue to do that to make sure that we are keeping steady and declining all of those mortalities as well as non-fatal overdoses.
Excellent. Thank you. Thank you for adding that to this presentation.
Yep. And thank you for the work we're doing there. Absolutely.
But I do want to say a comment about every time you have an overdose, isn't it somewhat like having a concussion? And let's say you're brought back by Narcan, but isn't there a cumulative effect to, let's say, if you just, you know, there are drugs you can take in order to get off the opioids, are there not? And it's like, you can't keep having overdoses. You know, at some point, either you'll get unlucky, but you're killing your brain. Isn't there something going on there that it's way more serious than we're really talking about?
I definitely would say that it is a very serious concern for us that we are taking very seriously as well as our treatment providers, knowing that, you know, we want people to survive to get to treatment. And we want that treatment to be successful, and we want that recovery to be successful, and making sure that we have services and supports for all Deschutes County residents to be able to access that, so they are not continually harming their brain, or they are able to have more full and productive lives. And that's something that all of our systems are contributing to make sure that people are surviving to get to treatment, are completing treatment successfully, and are in recovery successfully.
So if someone does an overdose on a Friday night, I thought Ideal Options was only open from like Monday to Thursday. Have they changed their hours? Does anybody know? On Ideal Options, I thought they were open like 10 hours a day from like Monday through Thursday, but have they expanded their hours at all?
That I'm not sure of Ideal Options hours.
Okay,
That's not.
What's the treatment availability?
but what if someone overdoses? Where can they get help? Let's say they want to do something with our deflection program. Where can they get help like on the weekend?
The Taylor Center.
Well, the deflection program essentially is only during business hours. So if someone were to get into trouble outside of 6:30 p.m., they would not have access to that. So
But they do have a referral and a requirement to
Mhm.
show up at a treatment center. So often folks will go to the Deschutes County Stabilization Center or other treatment options in the county.
Mhm.
Okay.
And yeah, it is a gap.
Mhm.
Well, I was just trying to like let the public know. So the stabilization center is what you're really saying.
Yeah, I mean, it depends on, it just depends on who's, oh, sorry. It depends just on who.
Would you
who's-
mind identifying yourself?
Oh, yes, sorry. Anna Woodburn. I'm the overdose prevention and response strategist for the county. Yeah, so it depends on who's open. There's, of course, you know, the treatment line that people can call. Let's say they were to have, regardless of deflection, if they were to have an overdose or something like that. There's, you know, websites, there's directories, there are, Best Care, I believe, has a 24-hour line. They just may not be able to enter into services right following that. Ideally, what we would hope for is to you know, continue to work on those linkages to care, so that somebody may be released from jail or released from the hospital could go directly into a treatment bed. That would be ideal. If someone were to experience an overdose or get released even from the hospital for some other reason, someone not using for a few days for any reason greatly increases their risk of overdose, particularly fatality from the overdose. So that linkage to care, straight from not use for any reason to, you know, being able to use, ideally would be right into treatment.
And I just wanted to point out that the Best Care's Taylor Center is open 7 days a week, from at least 8:30 to 5 p.m. On the weekend days. And I was under the impression that when a deflection encounter occurs with law enforcement, that people are actually, in many cases, provided transport to get to the Taylor Center. So that there's at least during the hours the Taylor Center is open 7 days a week, people have immediate access to treatment, consultation, and services.
Yes, yeah.
And then we do have our stabilization center open 24/7.
Mhm.
So, great. Thank you so much. Thank you for your time this morning.
Thank you very much, Commissioner.
Thank you.
We're now to item number 6. 5 minutes off calendar.
That was a good discussion.
Something for everyone. I have my shirt and tie happening.
Oh, you've got a bigger one.
Oh, very nice. No squinting here. I got glasses that I need. Yeah.
All right. Morning, Commissioners Nick, Kim, and Brenda. For the record, Anthony Regini, Principal Planner, Deschutes County. Before I get started, just for the record, in case anybody is watching, the assigned planner for this file was Caroline House, our senior planner. She's out on leave. And so in case anybody is wondering why I'm here instead of her, she's on leave, well-deserved leave. And so I'll be your staff for the purposes of the deliberations. At this point, just so others can follow. Stephen, have I been, there he goes, panelist. Awesome. I'm going to share my screen so that anyone watching can also follow along with the deliberation matrix that I handed out to the board just now. All right. So this is deliberation for proposed plan amendment and zone change for Destiny Court properties. The request is a comprehensive plan designation change from agricultural to rural residential exception area, along with an associated zone change from exclusive farm use to multiple use agricultural. The board may recall there was a hearing, you held a hearing on July 24th. And the deliberations are what follows for the board to make certain determinations on issues that were raised before the board. Before I get started on the issue areas, were there any questions from the commissioners that you'd like me to address in advance of the matrix?
Any questions?
Just acknowledging, thanks for putting that together. And I have the, the record up available on the laptop.
Anthony, I'm still, from what I've seen of the record, I'm still a bit confused about whether the property has water rights and has been recently farmed.
Sure. Exhibit 42 from the applicants, I think it's their either rebuttal submittal or their final legal argument, is a correspondence from Swally Irrigation District that the property does not have water rights. That's also in the matrix. I think it's issue number 2 for the agricultural lands analysis. So we have correspondence from Swally that the property does not have water right.
Mm-hmm. And then the photo documentation that showed that the property had recently been irrigated and farmed. I mean, is there?
Well, I think we should, in terms of characterization as recent, the photos are from 2012. And so I don't know that I would characterize those as recent photographs, but certainly there was photographic evidence submitted by Landwatch from 2012, which the applicant acknowledged in their rebuttal submittal, and there's evidence in the record that the applicant or the property owner at that time attempted to lease out the land for purposes of livestock grazing. The owner at the time installed a 2-pivot irrigation system, and after about a month or so of attempting to graze livestock, it was clear it was not going to be successful, and they essentially did away with the lease. So those photos are from 2012.
Thank you.
Any other questions from the commissioners? All right. So issue number 1, again, these are issues that were raised both before the hearings officer and the board. I'll remind the board that the hearings officer did recommend approval of the plan amendment zone change. And so the first issue that was raised really before the hearings officer had to do with goal 3 and the agricultural lands analysis. As the board, you have at this point plenty of experience with plan amendment zone changes. The OARs that govern this analysis really are broken up into 3 subsets. The first factor to be considered is whether or not the subject property meets the definition of agricultural lands based on soils classification. As you'll note from the deliberation matrix, there was no argument or evidence submitted to specifically refute the soil study that was submitted by the applicant. In that soil study, it was found that the property is predominantly comprised of class 7 and 8 soils. And for this reason, the hearings officer found that at least for the first OAR factor, the subject property is not agricultural land with respect to soils. So the first question before the board this morning is the subject property agricultural land with respect to soils? If no, then the board can continue deliberations and move potentially to an approval. If yes, then the board can move to deny the plan amendment zone change.
Because it was 2/3, it's what, 65.8%?
It was approximately 2/3.
So I would say, if no, we can continue with our deliberations.
And I support the hearings officer conclusion also.
I'm comfortable with the soil study.
Thank you. So then we'll go to issue number 2. Again, we're still in the OARs regarding the agricultural lands analysis. This one is the OAR provides a number of factors that need to be considered to determine whether or not the property qualifies as agricultural lands. Those include soil fertility, climatic conditions, the ability for the property to be grazed, water right, as Commissioner Chang questioned earlier this morning. And then there were a number of arguments and put into the record, some of which revolved around, again, the 2012 photos. I'm glad Commissioner Chang brought that up, of the attempt to graze in 2012 that was unsuccessful, argument that profit is not a consideration in this factor with respect to whether or not it is agricultural land. In the column to the right, you'll see that the hearings officer made a number of findings, both specific to the OAR factors and also specific to the arguments made by, in this case, Landwatch. In summary, the hearings officer found that based on these OAR factors, the subject property is not agricultural land. You'll note that in that column, I've added some additional information that was supplied by the applicant to address this factor, including more information about the unsuccessful attempt to graze the property in 2012, the Exhibit 42 that I mentioned earlier regarding Swally irrigation and the lack of irrigation water right, and an argument by the applicant that the hearing officer also made, which is the consideration of these factors in and of itself is not sufficient to make a determination that the property is agricultural lands. It's really the consideration of all the factors together. So again, in conclusion, the hearings officer found that the subject property does not qualify as agricultural lands based on these specific OAR factors. And so that is the question to the commissioners, is whether or not the subject property is agricultural land based on these factors. And again, if no, then the board can continue deliberations and move towards an approval. If yes, then the board can move towards denial.
I would agree with the hearings officer. I would say no, and we could continue.
And I support the hearings officer conclusion also with the arguments provided.
Anthony, the letter from Swally, did it identify when the water rights were extinguished?
I don't believe so. I can confirm that. Should we move towards a decision, I can confirm that for you, but I don't believe it did.
It just says water rights are not on the property.
Confirm that it did not. It just says that as of today, there are no water rights on the property. Clearly, there were some in 2012 when they attempted to put the irrigation system, but sometime between then and now, the water rights were removed.
Yeah.
It just says, as of this date, there are no longer any Swally water rights located on the following properties. We're referring to the 2 tax lots. So that is how it's worded.
Yeah, since we're supposed to be taking this as a whole, I think this is pretty gray. I mean, the property has been used for farming in recent years. There were water rights attached to it up to a certain point. There are other kinds of farm uses that could occur there. So I appreciate that there are not water rights now, that there's no evidence of an attempt, efforts to farm the property in more recent years, but I feel like this is pretty gray. So I'm going to say no.
And we can certainly reflect that in the draft decision.
Okay, thank you.
Any other questions from the commissioners before we move on to issue 3? Okay, so issue 3, again, is the last sort of analysis related to the OAR, and this has to do with consideration of adjacent or nearby agricultural lands. And specifically, this OAR, and you recall from the Eden or the 710 properties ruling, it requires the decision maker to consider whether or not the subject property is necessary, and that's an important word, necessary to permit farm practices on nearby or adjacent farmlands or agricultural lands. In this particular case, there were no specific objections or arguments made that, or at least identification of nearby farms or agricultural lands that could use the subject property. And the hearings officer focused really in on that main issue, in that there aren't any, at least as far as the record is concerned, aren't any nearby or adjacent agricultural lands that could use this subject property. So again, the hearings officer found that for this particular OAR consideration, the subject property is not agricultural lands. And so the question before the board again, is the property agricultural lands? If no, you can continue deliberations and move towards approval. If not, then you can move towards a denial.
Anthony, I may remember, I didn't bring my map with me, that the nearest other EFU lands are across the river.
So there are EFU zone lands, and you're calling this correctly. The subject property is bounded on its northwestern border by the Deschutes River. On the east side of the river, there are EFU zone lands, but none of them are receiving farm tax deferral. They do not appear, based on the aerials, to be farmed. And so the hearings officer and the applicant both talked about that. West of the river, there are properties, and about a third of a mile away, that are receiving farm tax deferral and could be classified as being agricultural lands, but they are across the river and certainly not adjacent or convenient to the subject property.
And the immediately and a number of the immediately adjacent properties are already RR10 or MUA 10.
Right. The property, as I recall, is bordered on 2 sides by MUA 10, and then there are nearby urban area reserve UAR 10 zone lands. And then you have the urban growth boundary associated with the city of Bend. It's about a quarter mile to the of the subject property. Yeah. And so again, the hearings officer made a finding that there aren't any nearby or adjacent agricultural lands that could use this property.
I would support that finding.
Commissioners Adair and
I
DeBonne.
agree with the hearings officer's determination.
And
Record.
I do also.
Awesome. So we'll move on to number 4, which is a discussion of goal 14. So goal 14, if you recall, is the urbanization goal, and it is concerned with essentially allowing, it's not okay to allow urban uses on rural lands. And so the question before the board is, will the plan amendment zone change result in urbanization such that a goal 14 exception is required? And so the objections in a record really focused in partly on the future subdivision and the lot sizes that are contemplated as part of that subdivision, and noting, or at least making the argument, that a cluster subdivision is an urban use in and of itself, and that its proximity to the urban growth boundary is also a clue that this is urbanization. The hearings officer specifically addressed this goal by noting really 2 cases, the Schaefer-Curry case and its factors for analysis of urbanization, along with 1,000 Friends versus Josephine County. And the hearings officer's findings really revolved around one main issue, which is the proposed zone, MUA 10 zone, has been acknowledged by DLCD to allow only rural uses, not urban uses, and that proximity to an urban growth boundary in and of itself is not a sign of urbanization. He also pointed to the purpose statement of the MUA 10 zone, which is to allow, it's a transition zone from rural uses to future urban uses. So again, the idea here is that the MUA 10 zone only allows rural uses, and therefore this is not a violation of Goal 14 because it does not allow urban uses on rural land. So the question before the board is whether or not the proposed plan amendment zone change requires a goal 14 exception. If no, then you can move towards, again, approval. If yes, then you can move towards a denial because the applicant did not request specifically a goal 14 exception.
So I come to the conclusion of the same as the hearings officer. So no, it would be the answer to the goal 14 exception requirement.
Officer also.
Because of the I mean, 1.7 acre lots is not urban, but it's not rural either. I mean, this is also getting quite gray, and it's given the proximity to the urban growth boundary. I mean, I can see the argument for requiring a goal 14 exception. And so I'm going to say yes.
Okay. And we will reflect that in the decision.
It was interesting. The other day I was at Rooted Homes groundbreaking ceremony, and it was on a 2-acre parcel within the city of Redmond, a farm, and they're going to build their cottages. And then in that neighborhood, right on one of the major streets in Redmond, there are some people that own, I think, at least 2 acres. There's a couple sites there. So within the city of Redmond.
Yeah.
It's pretty fascinating.
Yeah. Not far from here. I mean, I was thinking about the properties along the road that goes into the Riley Ranch Preserve, Bend Park and Rec's Riley Ranch Preserves. There's I'm not good at estimating acreage, but there's properties along that road that, are well within the city's urban growth boundary that are probably 1.5 to 2 acre parcels. So we certainly find that pattern of development inside urban growth boundaries as well as outside.
Understood. Any other questions regarding goal 14? I think I have the commissioner's vote on that and your rationale, Commissioner Chang.
Thank you.
Okay. So the next one, this is second to the last, is during the board process, there was a question regarding the effect of ADUs. And so the applicant addressed this by submitting a traffic analysis. I'll note for the record that there were no specific objections with regard to ADUs and traffic. And I'll just very briefly highlight the traffic analysis, which essentially adopted. There is no standardized trip generation rate for ADUs. So there was an assumption made regarding ADUs and trip generation. And then the analysis focused in on the primary access roads to the subject property and found ultimately that even with the addition of ADUs, there wouldn't be a significant impact on county roads or their functionality or the expected types of trips that you would find on county roads. And so ultimately the analysis found that the TPR analysis, transportation planning rule analysis, was met, and there would be no expected impact from ADUs with respect to the transportation planning rule. So the question before the board is whether or not ADUs on the subject property will still comply with the TPR analysis. If yes, the board can continue deliberations and move towards an approval. If no, the board can move towards a denial.
Well, it looks like this topic is just kind of bolstering the applicant's argument, answering a question that may have been asked here. So I support that it would allow for transportation purposes and, in full light, knowing that maybe there's a future cluster development that may not even go down this path. But yeah, as I say, this in support of this application's information in front of us, I would say yes.
I would say yes too. Also.
Yeah, I'm comfortable with yes.
And we get to the last, and really this is just my attempt to button up the record. Again, the issues that I've raised before the board are those that were raised during the hearings processes. So all of the remaining issues addressed by the hearings officer in a multi-page decision involve a number of different criteria. And rather than go through all of them, I thought for the last one, this is an opportunity for the board to, if you had specific issues with criteria in the hearings officer's recommendation, we could go over those. Otherwise, the alternative is to adopt all of the rest of the hearings officer's findings, except as modified by the deliberations, as your own decision. So sort of an easy button if you wanted to go that route. Otherwise, we can go through the hearings officer decision for specific issue areas.
Well, yeah, so I support the fact that the hearings officer is a thorough and professional review of the findings, and I support the recommendation.
I do.
I don't have additional concerns.
Okay, so with that, I'm going to summarize the board with a couple of 2-1 exceptions. It appears is moving towards approval of the plan amendment zone change. I will note the additional argument from Commissioner Chang in relation to those that were 2-1. And then at a date to be determined, I'll come back before the board with a draft decision and coordinate that with Brenda. Are there any other questions or things that you would like specifically?
Is this a timely factor?
No. Nope. It is for the applicant, but not technically. I want to make sure that I acknowledge the applicant's attorneys behind me. So we will get to this as soon as we can and be back before you.
Okay, all right.
I mean,
It was mentioned to me yesterday because building all over our county has slowed down considerably. That someone was saying, why aren't we, actually trying to help people and fast track things more? So
Sure.
anyway,
And I will be
I
coordinating.
thought that was appropriate to say that at this
Sure.
moment.
And I'll be coordinating with county council and also the applicant to get the draft decision before you as quickly as possible.
Thank you, Anthony.
Mr. Lilac?
Well, I was going to say, commissioners,
Motion.
I'll look to legal counsel often.
Yeah, motion for the record.
Motion to.
Yeah, just so it's clear. Yep.
Provide the direction, but I'll defer to.
That's fine. Yes.
So I'll move approval of the plan amendment and zone change for the approximately 65 acres at 19975 Destiny Court. Written decision to follow.
I'm not going to second that.
Okay, so as chair, I will second that motion. Any further discussion?
I guess I would just say situations like this are very complicated. I appreciate the idea of the city kind of feathering into the rural, and that there should be a place for that. I do have, with this particular application, I'm struggling with this idea of the goal 14 exception because, as the city feathers into the rural, it's really hard to pinpoint exactly where the urban ends and where the rural begins. I mean, because there's this transitional zone in between. And I do think that that's where we're working right now. But I also, I'm concerned about the goal 14 exception. And I also, there's a lot of land in Deschutes County that is being farmed that has soils similar to this, that has water rights, and they may not be the highly productive, most profitable agricultural lands, but I do believe that there are a lot of people out there farming such lands with the intention to make a profit, and so. And it's also true that with certain kinds of agricultural practices, composting, regenerative agriculture, people can take what are mediocre soils and actually dramatically improve them. So I'm not ready to just kind of outright write off a property like this as non-agricultural either. So those are those are, my lines of thought on this, and I will be voting no on this decision, but unlike some some votes that I take, I can also very much appreciate the importance of having a transitional zone between urban and rural, and I'm not, I wouldn't argue that what the applicant is proposing is inappropriate for such a transitional zone.
Are there any other comments? Calling for the vote, Commissioner Devon,
Yes.
Mr. Chang,
No.
the chair votes yes.
Thank you, Commissioners. And Nick, thank you for the reminder about the motion. I had it in my agenda and always passed over it. So
Oh, I was ready also, though.
everybody was ready to back me up. I
Yep.
appreciate that. Thank you, Commissioners.
Thank you. Okay, other items? I believe, Eric?
Today's hit the microphone day. I think we've all done it sooner or later here. Well, I did it in a big old piece of paper earlier.
Good morning. For the record, Eric Crop, Deputy County Administrator. As discussed with each of you one-on-one yesterday, there's a draft resolution that outlines a temporary safe stay area. It's a draft joint resolution with the City of Bend and involves and creating an area at Juniper Ridge for vehicle camping. This came out of the joint meeting with the City of Bend, the Board of Commissioners had on, when was it, September 4th. And at the time, the City of Bend and the board directed the city staff and county staff to work together on a draft joint resolution. The City of Bend staff predominantly put together the joint resolution. I have a copy here that I'm happy to pass out to the board. And really the question for the board is, would the board like us to schedule this for board consideration next Wednesday? If so, how would the board like us to structure the meeting? We could just do it as a staff report, or we could do a public hearing where people have 3 minutes to comment. And then the final question is if the board would like us to schedule that next week, we have a draft press release for review.
I'm interested in a copy of that. I didn't bring it down. Thank you.
Friday at noon. Friday at noon. It's gonna rain.
Or at least the winds are going to come.
It's not gonna-
Also, I'm happy to walk the board through the draft resolution and highlight the major items if you'd like.
Could you remind us, we got something from community development, kind of a administrative decision about the big picture here. I'm looking it up right now, and I was able to review that. I think it was just kind of an administrative decision about the utilization of the land, or
Community Development submitted a
staff report.
staff report to the board, sharing their perspectives on the proposal and identifying a number of issues that they believe should be addressed pertaining to rural land use, wastewater enforcement. A lot of the issues that are identified in the draft resolution under number 5 were identified and addressed in the Community Development Department's memorandum.
Yeah, so that's a little bit more information on kind of the staff report reviewing the big picture.
I
You
have
know-
a question about the 170 acres. Just, okay, we were talking, I think about, maybe it was like 1,000 acres or something, and they were on 100 acres and they were gonna move them all over. But I don't wanna just bring this down to 170 acres. I mean, I can't really tell by that line if that means that they can still be on the 170 acres. Cause we need to have something really clearly defined where people are living.
Yeah, the 170 acre refers to the county-owned land that currently people are using. In addition, it includes the city-owned land. What the joint resolution proposes is closing the city-owned land east of the railroad tracks. And then really it's the land, city and county-owned land between the railroad tracks and Highway 97,
So how much is that?
170 acres.
See, I think that's too big. If we're gonna ask people to move and give them rules and guidance, then it's gotta be smaller than 170 acres.
Yeah, one of the issues with what's being proposed is it's not a managed camp. You know, what's being proposed is not a managed camp. It's just an area that people are temporarily allowed to live in their vehicle.
But if the board has a proposed change to the draft resolution, certainly we'll take the direction and we'll coordinate with the city on what the number should be and where the location should be. If it's not the full 170 acres, then what area should it be and how large? That's certainly at the board's discretion.
Fires did we have started, in August, like through the 12th, August 1st through the 12th, I think was something like 8 fires that were started by transients. We've got to make clear rules. I don't know. I was just talking to Chief Porter Saturday, who runs, who's the chair of Central Oregon Villages. And he said, now I know that's High Barrier, the Central Oregon Villages, but it just seems like telling people they have to move from the 1,000 acres to 170 acres really isn't giving definition. And I think we need more definition. What was it? Fire like every other day?
I think we can accomplish many of the things that we're intending to collaborate on without this formal designation and without triggering a variety of differing legal opinions on land use, on how this land can be used. I don't think that what we're doing in the county's portion of this 170 acre area is really going to change that much. Except that we may, provide expanded case management and supportive services to help move people out of homelessness. That's not something that is land specific. I mean, we could partner with the city of Bend to offer additional case management and supportive services more broadly, and we could continue to do what the county is doing on its portion of the property of this area. Porta potties, porta potties, dumpster, etc. And the city could move, because really, in terms of the changes in where people are, and what would be offered, in terms of service, physical infrastructure type services. The change is all happening on city land. So I'm hesitant to kind of pursue this designation, which has, land use legal implications, which get county legal and city legal into kind of disagreements about, whether something can or can't be done. So I guess what I would suggest is a very something much more stripped down that's really about the provision of case management and supportive services. The county will do its thing on its portion of this area, and the city can do its thing on its portion of this area, and we can have more informal coordination around this area.
I'm supportive of proceeding, knowing that this is, action in partnership with the city of Bend to show support for people that are in need. Also, lean into our cultural expectations about how our public lands are used. This is city and county land. We've got federal land around us also. So the decision points I'm seeing is, do we make this a public hearing or not? The proposal is kind of a starting point is to make it a public hearing on a resolution. Is kind of from legal point of view, is that a requirement or is it an option?
It's an option, given just the
Well,
notoriety.
and I'm acknowledging the sensitivity of this issue, but it's a choice.
It's a choice.
Yeah. Okay. And we haven't got there yet as a group yet, but I'm just trying to think that through. And then also, as I'm reading this, a different path, just the word Juniper Ridge, it's historical. It's a lot of land that the county gave to the city many years ago for $1. It's got a lot of history there. This area has been called Dirt World also, but maybe, we refer to it in a little bit more generic fashion, is referring to the city and county land just north of the city of Bend, and even have this conversation with the city of Bend, because Juniper Ridge can be this beautiful place that's going to be developed inside the city someday. So by calling this Juniper Ridge, we got to be careful with the kind of the branding of Central Oregon is what I'm thinking.
Well, if we're talking about branding, it still looks like a terrible eyesore when you drive up.
Well, but
97. It's looked disgusting.
But we
and
have
it's
large
still-
corporate people that are building, and the utility or the new, city of Bend facilities are being built at Juniper Ridge. So I'm referring to that, the land that's inside the city that's being developed for corporate and public purposes is different than the land outside, which we still call Juniper Ridge. So I'm just pointing out that we maybe want to strategic about what we're referring to here in the words. That's all.
And we still have a chop shop there, don't we?
Oh, yeah, no, I'm not.
Yeah, no, I
And
mean,
we're talking about the Juniper Ridge north of this urban growth boundary, because Juniper Ridge is the place where we have jobs, corporate activity, and future developable land that should be positive.
okay, we're talking about Dirt World then. And
Well,
you're
yeah, as I
saying-
said, Dirt World took off all by itself, and it's a shame it's called that. But as I say, let's try to be a little bit more respectful about the terminology. That's all I'm referring to. So it looks like we're in that same spot. This happened on the east side of Redmond, where I said, how about we define an area a little bit less direct services, welcome people there, offer services, and move forward. And so define 170 acres between railroad tracks and the highway, define the entrance off of 97 with the authorized entrance, a little bit more control there. But then, come as they may and offer services as things happen. But then you're getting to a point where you want to offer more control up front.
Yeah, this is really different because in this case, we're talking about city-owned land and county-owned land outside the urban growth boundary,
Mhm,
as
mhm.
opposed to county-owned land
Yeah.
inside the urban growth boundary. And I'm just saying that I think that each jurisdiction should set up the physical infrastructure and set the parameters on the property that they own. And that we can coordinate on the provision of case management services. That could be what we formally collaborate on and put into writing. But what are you doing on your land? What are we doing on our land? Does it add up to a, kind of coordinated approach that can be done informally?
Well, and I think the city's going to rely on us for the resources that we've held back from the American Rescue Plan dollars. They're going to say this is outside the city, and they're going to lean on us pretty hard. And as I say, this is relationship building at this point in time.
Well,
So
we've already said they want it on this side of the railroad tracks, and who has most of the property on the west side of the railroad tracks, but the county, so, yeah.
Most of this 170 acre kind of little kind of polygon is city property.
Of the 170 acres that's being proposed, 50 is county and 120 is city.
And we're already we've already done something. And I don't think that there's, besides the provision of case management services, I don't think that there's any discussion about the county doing anything different in those 50 acres. So that's why, again, I want to separate the kind of the facilities and the land use from the case management services, which is the thing that we would be doing differently, under this plan. And I think we can make that as formal as we want. And I also think that we can make a funding commitment to that. That if the city, based on our experience, it's not cheap, but spending $15,000 a month for porta potties, security patrol, dumpsters, etc., I assume that's something that's within the city's capabilities. That the real concern is, the really big cost is, how are we going to provide a more intensive case management in this area so that we can actually move people out of homelessness.
Right.
I would also like to,
Water every Wednesday isn't really accomplishing anything, and it's the case management and the consistency of the case management. And honestly, I would think we could work together with the city on case management, but clearly that's what we need. That's what we haven't been doing as much as we should in order to turn some people's lives around.
I would like to also note that there are some things in the draft resolution that I'm not sure if or how we enforce on county land. Specifically, the resolution says that the area would be limited to vehicle camping. I'm not sure how we would evict somebody who is tent camping or in a structure, even if it's illegal. The resolution also says that the area is intended for people currently living there, not people relocating to the area. Again, I'm not sure how we would enforce that. And then the last piece is the draft resolution calls for the temporary safe stay area only lasting through December of 2026. At the end of that time period, I'm not sure how we would move people off of the land unless we had an alternative location. I mean, we would obviously work through those the best we could, but those are just some things that I noted, given that there's a team of county employees that have been working on managing the Juniper Ridge land for over the last year.
So I guess that's my proposal, is that we coordinate informally on space and facilities and infrastructure, but that we narrow the scope of any kind of an agreement to the provision of those case services, which are going to help move people out of homelessness, not just on the city land, but also within the 50 acres that the county owns within this 170 acre area, which we can brand whatever we want.
So commissioners, I'm hearing right now, one commissioner supporting proceeding with the resolution for a meeting next week, and one is not, but not meaning that we still coordinate with the city on all of the things that Commissioner Chang mentioned. So we'll just wait to see if there's a second vote on which path to proceed so that we know what the direction is. Eric, unless I'm missing.
No, that's correct. The other option is we could bring both proposals. We could bring both proposals forward for consideration. I mean,
Next week?
an option.
Yeah, I mean, honestly, I hear our community, and every time I drive down or drive up Highway 97 and I look over at that mess and I think how long it has been there and how many fires we have had, it's got to be tightened up. We've got 50 acres there. Let's use 5, let's use 10 of our acres, but we've got to get case management in there on a really consistent basis. And, you know, talk to people that are willing to do that. And it just seems like, yeah, we've been really lucky so far. And as what our DA said to us quite a few months ago, it's our opportunity now to do something that will make a difference.
So, as I say, with, Eric's pointing out that, how do you define who can be there, tent camping, the date of 26. I mean, this is just a huge dynamic issue that we're dealing with. And this is, the Western United States, and this is trying to take action in a local location. So, I mean, I do come to the conclusion that, I support the resolution, and we could slightly edit it, but I mean, I support the intention of the resolution and generally how it's written up.
Well, I just want to comment because we are working with the city of Redmond, and I feel like that proposal going forward on county land, but a portion of it is really hopefully going to be a successful model for other locations in the county. But I do feel like minimizing the risk and exposure and cleaning up our land. When I hear about code enforcement, about people in our county and they are cited,
I agree.
I am sick of it. I am sick of it. We are exciting our residents to pay their property taxes, and yet we are allowing this to go on for years and years and years. It's got to stop. It's got to have, we've got to get control of our land. I mean, those people that get code enforced from us, they're really frustrated.
Yeah. And I guess I would just say that in the county's 50 acres, we've provided a big bump up in safety and stability. And what I think is missing on the county's 50 acres is those supportive services and the case management that will help people who are, feeling safer and feeling a little bit more stable and a little bit more human in the conditions that they're living in, exit homelessness. That's much more the missing piece. I mean, when we think about, why does safe parking work? Well, you give people a safe, stable place, and then you add the case management and the magic happens. What's not happening in our 50 acres? We've improved safety, we've improved stability, we've improved sanitation. We haven't really added those case management services, and hopefully that would be how we fix our 50 acres, how we meet our responsibilities to neighboring property owners, that were the source of those code complaints in the first place.
We're going to have a public hearing next week.
I mean, I guess I want to ask whether if I'm talking about an agreement to provide jointly provide case management services, is that a resolution, or is that just some kind of simple agreement between city and county?
Yeah, resolution is not required for that. It would be contracting with a service provider or provider.
Spending money.
Yes. And there is currently services at Juniper Ridge. There are different nonprofits that that go out there, including our host team. What this discusses a little bit more intensive case management services.
No, I'd say daily case management services, the 4 out of 7 days a week where you actually can make serious progress. And, you know, it's still, I don't know how many times you drive that road, but I drive it a lot, and it's awful. It's really awful. And I've had several people call me to tell me that they've been code enforced about things lately, and they're going like, what is this double standard, Patty? Why are, you know, in this 97, the corridor, here we have, you know, something that definitely needs cleanup. And we've spent a lot of money and we're not there. So I believe that it's the case management and perhaps getting rid of the chop shop sooner rather than later. Really, I've been talking about it for over a year now. It definitely needs to go.
So I just want to say I'm open to this idea of bringing this joint resolution and this, you know, case management services agreement, you know, at the same time. But I don't know for the agreement whether we need to have a formal hearing. So it's a little bit odd to, you know, to bring both of them forward during a public hearing.
Well, we've heard from the people that live there, the people who have had gates broken into, shots gone by their head. You know, the community definitely has been putting up with a lot in the neighborhood. So, you know, I don't know if they're going to want to come in and testify for another time about the stress they deal with because they are located next to the county property and the city property. So you're saying that we really don't need a public hearing?
It's not required. It would be your option.
Well, I do believe, yeah, we need to work together with the city on case management and actually more cleanup on our 50 acres because they're not there.
So as I say, I am supportive of defining that 170 acres as a temporary safe stay area, acknowledging it's going to be a wild ride no matter what we do, but this is partnership with the city of Bend. This is putting a little bit more control in a defined space and offering services and, you know, moving people along to a better situation.
So Commissioner Adair, I guess the question is, Commissioner DeBonne wants to move forward with the resolution. I'd prefer to move forward with some kind of an agreement for case management services, and each jurisdiction does its own thing with the physical site. And you're in the position to either say this one, that one, or let's look at both next week.
Well, we could look at both next week, honestly. I'm definitely for the case management. I totally believe that's incredibly important. And I can imagine that maybe some of the community are want to give us some feedback in the next couple of days, because we are at this important time where I believe we clearly have to make a stand and case management and cleanup by the county. So anyway, I'm happy to bring it back next week with that.
Bring a draft agreement and a draft resolution. Okay.
And make a public hearing?
I don't think she just said we didn't need a public hearing.
Well,
I mean, is the public going to want to? The public's probably, I'm sure they're going to want to come back in. They're so frustrated. Yeah, hopefully we'll have a blizzard by then and the fires will go out. Yeah, it's been a really a trying time for our community, and I feel really badly for people that have had to deal with this for years. So, and yesterday I want to repeat again, I did meet people that had been living out on the other side of Redmond, and they actually found their way. So thank you, there are people out there that can make the difference. So let's keep hoping that we can find more caseworkers. So next week, public hearing then, it sounds like 2 people wants it. And I'm sure the people,
If we're looking at both things, I would support having a public hearing as well.
okay, all right. Sounds like the 16th.
Okay, we will plan for that. Do we want to, would the board like a press release?
A press release.
Or we could just, if not, we could just note it in the staff report that there would be an opportunity.
No, we need a press release because the county, I mean, I am irritated. I am irritated that people are getting code enforcements over trite, hardly anything things. And we have a tremendous eyesore going down Highway 97. So, yeah, I think a press release is appropriate.
So as it say, I support the content as written, maybe just massage the concept of Juniper Ridge, just because it's kind of the brand of an industrial area in the city of Bend as well as the region north of the city.
So what I'll do is I'll update the draft press release to include the other option of a more focused on case management. We'll circulate it to the commissioners and try to get that out probably tomorrow or no later than Friday.
Great. Tomorrow would be good.
Yeah, I mean, I think it could say something like, county is contemplating 2 different pathways to partner with the city of Bend to address homelessness, in whatever you want to call this area. And
Not dirt world.
All right.
It was the site of OSU Cascades, but then something happened.
Possibly.
No, it was originally supposed to be where Oregon State University Cascades was going to be located. And then something happened. So. All righty. Anything else? Do we have an executive session today? Not today. Okay. So are we good then
I
to,
got a couple items.
okay. Okay, I'm supposed to go to a breakfast.
That's fine, real quick.
A lunch that was
So yeah,
like 11 o'clock, but I'm late now.
the field hearing for the Water, Wildlife and Fisheries Subcommittee for congressional field hearing yesterday. Honored to be speaking with the other panelists. They were well attended, probably 200 people or so in the room. And as I say, I was able to communicate with Commissioner Chang as he walked in the door yesterday at that hearing and say, what topic would you bring up here? And he mentioned wells going dry. So I was able to do that. I did forget to mention juniper
Junipers.
removal.
I know, I'm sitting by Tim DeBoot. I go,
I
well.
I mentioned it to him right before.
Oh, he's gonna.
I wrote it in there,
No,
but
somebody else did mention Juniper.
yeah. So as I say, it was mentioned, and the representative
million.
from, I think Idaho, she knew all about it already too. So that was good. So I was honored to be doing that. Also, during this meeting just now, I was notified that the Lapine Park and Recreation District Board has resigned as a whole, and the director resigned also. So that's an official notification by a staff person, as I say, just a few minutes ago during this meeting. So we've got a local Park and Recreation District, Southern Deschutes County, that's going to be leaning on us as a Board of Commissioners to reappoint, is my understanding, reappoint or appoint a new board. So as I say, I think there was either 3 or 4 active members on their board, and everybody just resigned at a 10 o'clock emergency board meeting this morning. So we can learn more about that together and respond accordingly.
yeah, I've been hearing quite a lot of rumblings in the last few days about the situation down there, and I think it'd be very important for us to learn about get a comprehensive understanding of what has happened. I want to make sure we hear from all sides of the conflict. Because it sounds like it's been quite a conflict before we make any decisions about how best to essentially repopulate the board of that district, because we don't want to we want to make appointments that are going to help resolve the conflict and the underlying issues, not perpetuate them.
Perhaps it was finances. Somewhere there. right.
Sounds like it was more than that.
Okay, so any other comments for the morning? So we will have a meeting, not next Monday? Do we have one Monday, Brenda?
Yes.
We do. Okay. Okay. All right. Okay. So, and then we'll have our meeting next Wednesday morning, which you can come in and make public comments about Juniper Ridge. Thank you so much.
Wait, kind of just following those other items, I'd like to ask Commissioner DeBonne. I was only able to attend the first hour of the field hearing that Congressman Betts put together. I heard a very brief mention of groundwater concerns and groundwater going dry, groundwater levels declining. When I left, the congressman had kind of he was trying to put together some kind of an argument about why it was the federal government's fault that groundwater was, why we're having groundwater problems. And I certainly didn't track what his line of argument. And I was wondering whether there was any more discussion of that during the hearing, and if not, then what kind of solutions were offered to our groundwater concerns in the Deschutes Basin?
Yeah, so as I say, it was informational. The representatives from out of the state got to learn a lot about it. Topics were discussed. There wasn't action items, real tangible action items to say we're going to do this or advocate for some specific federal
There
item at
was
this
one
point.
action.
It went back, yeah.
Fish and Wildlife, the bullfrog eggs are supposed to be destroyed in the month of June, and it's been 4 years that had been set up, and they hadn't been getting any answers. And so
Habitat
Congressman Benz,
Conservation Plan.
yes, Congressman Benz said, Trish, Dr. Baxton, please write your letter. We will send it on to Fish and Wildlife and actually get numbers, because they should have numbers,
So it's just mentioned that, yeah, the HCP
Right.
has action items on both sides, and it's just a question of how much management is actively being done on the federal side. So that was the one item that went back and forth.
Okay, yeah, that HCP has nothing to do with groundwater though. So, I mean, did Congressman Benz elaborate on why he thought it was the federal government's responsibility that groundwater levels were declining here? Okay.
Meeting adjourned.
I was leaving because.
Okay, thank you.
It's gonna